Good afternoon. I am Dr. Jennifer Merlo. I want to just welcome everybody to our webinar with Shepherd Veterinary Software. For those who do not know me, I am the Director of Veterinary Affairs here at Fear Free, and I oversee our practice certification department as well as working with some of our corporate partners like Shepherd. I'm very excited for this webinar this afternoon. I'm very happy to have Christine with us. We partnered up with Shepherd last year, and we were talking about how to make practice more efficient. And we know we get a lot of requests about integrating Fear Free into practice management software. And that's always been a challenge until Shepherd came along, and they were wonderful enough to approach us and say, hey, we want to be the first PIM system that integrates Fear Free seamlessly into what we do so that we can help Fear Free members, Fear Free certified professionals work in a more efficient way and just increase what they're able to do during the day. We all know efficiency and workplace productivity are the buzzwords of 2023. So really excited to hear about all that Shepherd can do for you and your practices. I am going to hand this off to Christine. Christine, remind me again, where are you located? I know we're close by.
Charlotte, North Carolina is where I live.
That's
Yes, but we are headquartered in Prescott, Arizona, and we actually have an office in New Jersey as well. So, but
awesome.
Yes, you're looking back here in my background right here is Charlotte, North Carolina, and we are actually having a pretty nice day out today. So
Yep, I knew we were close. I was like, I know she's close to me, so I'm about 40 minutes from you. It's beautiful here in South Carolina today too. So without further ado, I'd like to introduce Christine and Shepherd and let her educate you all on what we're doing with them. If you do have questions throughout the webinar today, just pop them in the Q&A box and we will get to them. We will have a time for questions at the end as well.
Awesome. Thanks, Jennifer. Thanks for the introduction. So hi, everybody. Just to do a brief introduction of myself before we hop in. My name's Christine. I am a senior product advisor here at Shepherd Veterinary Software. I've been working in this industry now for 12 years, 8 of those years working as a technician. So I'm truly really excited to show you guys how much easier your lives can be inside the practice by using something like Shepherd. Now, I already know when I mention practice management software, so many of you are either rolling your eyes or your eyes are starting to go cross-eyed. And I totally get it, honestly, because that was me too. But I talk to hundreds of practices every day, and well, I don't talk to hundreds of practices every day, but I've spoken to 100 practices at this point with my career now as Shepherd, and I have found that so many practices talk about how clunky and inefficient they think their current software is, or they're just dreading the conversation of software because they're using paper medical records or something along those lines. And that's just how they perceive software. But this is where I come in to tell you guys that we got your back. So what do we know about our industry today? Y'all are burnt out. I was burnt out. So I couldn't relate to this anymore, and why I feel so passionately about it, and why I really do think Shepherd is the best thing since sliced bread. So there are so many factors that are contributing to these negative statistics. And I know when you think about burnout, you don't automatically associate it with a software. But again, I'm here to tell you that Shepherd can help. The entire reason Shepherd was built was because of burnout. So I'd like to introduce you to Dr. Cindy Barnes. And what I love so much about Dr. Barnes is that she's not just a practicing emergency vet, but she is also a mom of 5. And so you can imagine she had a lot of competing priorities in her day-to-day, which made her realize that she really needed a software that was going to do a lot for her, which in turn allowed her that time at the end of the day to go home and spend time with her family. This is how Shepherd was born. And not only is Shepherd an extremely user-friendly platform, but it's also extremely efficient. And that goes for everybody inside the practice. So for the vets, the practice managers, the technicians, the CSRs, the assistants, there's so much that Shepherd does for everyone at the practice. And our goal is that you guys get to go home on time at the end of the day too. You deserve joy. Now, one more time for the people on the back. You deserve joy. And the fact that vets deserve joy is our motto is something I'm really proud to shout from the rooftops. You as vets and vet staff deserve to take home more stories and less stress. And you guys simply deserve more work-life balance too. Am I right? So let us help provide more of that work-life balance in your day-to-day. How can a software help provide more work-life balance, you may ask? Well, so many reasons, but here are a few. So our SOAP-based workflow was really designed to work the way your practice naturally operates. So you can enter a patient's information once, and then you can let the robust automation tools take over from there. It saves you time, it eliminates duplicate steps, it captures all of your charges, it minimizes the chance for human error, and it ensures consistent patient care. We also have so many templates. And what's great is you guys get to create and customize as many templates as you want. We're going to come loaded with a bunch of them, but again, customize them, delete whichever ones you want, and really make them look how you want. And what's also really neat is that we also have interactive body maps that can be attached right onto physical exam findings, which eliminates having to scan and attach anything into the software. I'm excited to show you this because the body maps are something I was over the moon about when we released them. And so I truly think that they're the bee's knees. And so I'm going to for sure highlight that when I start to show you Shepherd. But not just the physical exam templates and the body maps, we also have customizable forms. So think of your forms as like your consent forms, right? So euthanasia, sedation, surgery, new client form. And now with our partnership with Fear Free, we also have the pre-visit questionnaire that is Fear Free specific, built right within Shepherd. And how all of our forms work is you get to send to the client before the appointment via text or email. They will then fill that form out digitally. And then when they click submit on that form, it will automatically furnish into the patient record. So there is absolutely no scanning and attaching, my friends. It's all done for you. Also with Shepherd, everything that you guys need to run your practice is on one easy to use platform. So we have unlimited two-way texting, automatic appointment reminders, automatic service reminders, online booking, a client portal, anesthesia monitoring, dental charting, and really so much more built right within the software and all completely for free. So I know change can seem scary, and so many of our practices are afraid of the cost associated with making the switch. But I'm really here to tell you that it doesn't have to be this way. What so many practices don't realize is that a software like Shepherd can help ease so many of the pain points they experience in the day-to-day without having to break the bank. So we'll migrate your data from your current PIMS completely for free. And we have seen that so many practices ended up saving money on a monthly basis because they could stop paying for all the third parties they were utilizing, since Shepherd has everything built in and at no additional cost. Not to mention, Shepherd is the only software that partners with Fear Free and has Fear Free workflows built right within the software. So we've really reduced the amount of time and paperwork it takes to be a certified practice. And we have an EMR embedded directly into your workflow to quickly access and track that patient's FAS score and changes over time. So with that, let's go ahead and hop in. I'm excited to show you Shepherd and really everything that it can do for your practice. So I'm going to go ahead and switch over here to Shepherd. So this is Shepherd. Now, this is going to be your dashboard, which is really going to serve as your center hub for all things happening within the practice, and really going to be the very first thing that you guys see when you first log into the software. Active patients here will be the very first thing that you see. And these all represent active SOAPs that are automatically created for you when a patient is checked in. So some really good high-level information that you will get from this active patients tally here are patient and client alerts. Now, the alert systems are super helpful if you are wanting to track some higher level fear-free information. So maybe it is recommending trazodone before this appointment. Maybe this patient does great with pheromones before the appointment. If there is anything pertinent to scheduling, go ahead and make an alert because it's going to automatically populate for you every single time. You're also going to get the exact time that this patient was checked in, and location. So this is something that my technician self absolutely loves. And I know this is a really small feature, but it's one that I find just really comes in handy in the day-to-day. And you guys can build in whatever locations that you see fit. So whether it's a physical location, something like a service-based location, or my personal favorite is you can use it as a status. And what's really nice about it is it can be updated as you go throughout the day. So if TMA was here for a surgery, this location can be updated to being pre-medded, in surgery, discharges in, ready to go. And the goal of it is to really keep that communication between team members. You have your doctor column here, which can always be filtered on name. Assigned users. Now, your assigned users will typically be your technicians or the assistants or both that are assigned to each patient. And then your reason for visit is going to automatically populate for you based off of the appointment calendar. So from your active patients, I'm going to just briefly touch on diagnostics to mention that we are a software that is bi-directionally integrated with IDEX, Antec, Zoetis, and we're currently working on HESCA and Ellie Diagnostics as we speak. So from here, I want to walk you guys through scheduling an appointment. So there are really two ways that your clients can schedule an appointment. One is through the client portal. So just to touch on our client portal really quickly, we have a portal that we provide to our practices completely complimentary. We don't charge for it at all. And it's going to allow the clients to request appointments, request prescription refills, have a summarized version of all of their medical records. They can see the reminders, print vaccine certificates, and they can pay online. And so there are so many functionalities from that portal that we offer to our practices completely complimentary. But let's just say the more traditional way is that you are having a client calling you to schedule an appointment, in which case I'm going to simply check out and look up this patient with any piece of information I have on them. So whether it's a partial last name, a cell phone number, an email address, a dog breed, a species, you name it, it's going to populate for you here. And I'm going to go ahead and click on Moo because Moo is the one that we are wanting to schedule an appointment for. So, again, one of the benefits to being made by an emergency vet is that you guys are going to get all of this high level information you need on one page without having to dive super deep. Patient alerts are one of the very first things that you see because they're going to be in red here. But when you look right under this, this is where you see the emotional medical record right inside the patient record. So when you are going to schedule this appointment, you get to see the interventions, techniques, FAS scoring in different areas of the hospital right here inside the patient chart. So having a software that allows you to manage your fear-free workflow as efficiently as possible is a total game changer for our fear-free practices. Not to mention, this is an interactive module where you can actively contribute to the progression of this patient's FAS scoring over the duration of her life. And I'm going to show you exactly where you can track this on a case-by-case basis when we walk through the SOAP together. But for now, let's go ahead and get that appointment scheduled. So I'm going to navigate right over here and click on this little plus sign, which is going to bring me to my appointment calendar. So this appointment calendar is completely customizable. You guys will really make this look exactly how you want it to look. All of your different appointment types, as you see, can be different colors. You can have recurring blocks. If there is a doctor at the practice, if you're a multi-doctor practice and you have a doctor at the practice who does a certain appointment type, or maybe it's a certain procedure that the other doctors do not, you can set it up inside Shepherd to where that specific appointment cannot be scheduled under any other provider other than the one that actually does it. But I'm going to go ahead and schedule an appointment right here at 11:30 for Moo. So let's just say she's here for exam and vaccines. Client and patient automatically populated for me. Appointment type, you guys build in exactly what appointment types you want to see. And again, when you choose that appointment type, it does automatically populate that duration for you. So I'm going to go ahead and click save, right? So now that Moo is on the appointment calendar here, Shepherd is going to automatically send this client reminders of their appointment. Now, what's really nice about the reminders is they're going to go out via text and email unless the client prefers one over the other, in which case Shepherd will remember their preference. But you guys get to customize the verbiage of those reminders, and they can be customized per appointment type. And so your surgery reminders can say something different from your fear-free happy visits, which can say something different from your canine wellness visits, so on and so forth. You guys get to customize those completely. But let's just say that now that Moo's scheduled, we want to go ahead and send her all of the forms that she needs before this appointment. So I'm going to go ahead and click right here on her name, which will bring me right back to her patient chart. And I'm going to navigate right over here to this form section. Now, this is where you can send the form right from the patient chart. And the best part about our PVQ specifically, so I'm going to go ahead and choose the pre-visit questionnaire, is that they already come inside the software fear-free specific. So you don't have to add these, we do that for you. So I'm going to go ahead and create this form, and you can either send this via email, you can send it via text through our unlimited texting center, by the way. So it's two-way texting, completely unlimited and completely free. And of course, the entire correspondence automatically furnishes into the client chart. So you can always reference back to previous conversations. But I'm going to go ahead and click on this link. So that way you can at least see what that pre-visit questionnaire could look like. And this is what the patient, or excuse me, the client is going to be filling out. And the best part about this is when they submit this form, Shepherd's going to let them know that that form was submitted successfully. When I actually go back into Moo's patient chart, you'll see that it automatically furnished in for me. So there is absolutely no need to do any scanning and attaching at all. Now that goes for all of our forms, all of the consent forms, the pre-visit questionnaire, and all of that. It all is going to automatically furnish in for you. But let's go ahead and fast forward a little bit, right? So let's just pretend it's now time for Moo's appointment. So this is, again, where our client portal comes into play. So I'm actually going to hop into the client portal here to show you from the client perspective. This is what the portal looks like. Now, this is completely customizable. This is the landing page of the portal. It's customizable to the practice. So we can get your logo here, customize the colors and the pictures and all of that good stuff. But as you can see, this client can now virtually check Moo in right from the portal here. So when I go ahead and check her in, I'm going to go ahead and confirm my check-in. If I go back to the clinic perspective now, so back here inside the Shepherd account, Shepherd's alerting me that I now have a new portal check-in. So if I click over here, you'll see this right here. So now that I know that they are here, what's great about this is now I can go get that room prepped for whatever techniques work best for this patient. So maybe I need to adjust the lighting. Maybe I need to spray some Adaptil or some Feel Away. But regardless, you'll get that room set up for that specific patient's needs. And then you can either walk out to grab the patient, or you can, again, use the unlimited texting center. Just go ahead and send them a text to let them know that their room is ready to be seen, or for Moo. And so when it's time to actually, let's just pretend that you went out and grabbed Moo and you're bringing her into the exam room. So I'm going to go ahead and confirm that check-in. And then from here, oh, you know what? That was from an older. So let me go ahead and redo that again. So I'm going to go ahead and confirm that check-in. And then here it is. It's right here. So the 11 to 11:30. I'm going to go ahead and click that plus sign, which means that I'm ready to see Moo, right? So at this point, when I clicked that plus sign, my SOAP was automatically created for me. This is where whoever is checking her in can update that location to where they plan on putting her inside the hospital. But to come full circle for you guys, if I now go back to my dashboard, you see that Moo is now part of my active patients tally. And then to get back into that SOAP, I'm going to simply click right here, right back inside my SOAP. So here's where I'm going to put her weight in pounds. Now you're going to see it goes back to kilograms. That's just because we have an auto dosing calculator built right within the software. But if you wanted to see that conversion back to pounds, you still can do so just by looking right up here. Estimates. So the estimate workflow is actually one of the very first things that I fell in love with Shepherd, because to me, it just makes so much sense. And there are two ways that you can do estimates with Shepherd. So one is before an appointment, where you can create that estimate right inside the patient record, email it right through Shepherd over to the client so they have visibility into what to expect for that day. Or you can create one right here inside the SOAP itself. And I'm going to go ahead and do that just to show you guys how simple this is. So here is where I can add services in individually, or you guys can create bundles. Now, what's really nice about the bundles is you guys can create as many as you want. So have one for pretty much anything and everything. So vaccines, puppy, 1, 2, 3, and 4, surgeries, hospitalization, you name it, you can have a bundle for it. You can always add to that bundle as you go, and the bundle can always be adjusted. But let's just say that I'm going over this estimate with a client and they just so happen to decline a certain service. In this case, it's the Bordetella vaccine, because Moo doesn't go on walks. She doesn't go to dog parks. She just straight up does not leave her house. So we're going to go ahead and decline that service right here on the estimate. And then Shepherd's going to give you the option to go ahead and manually approve this, or you can go ahead and request that client signature right here through the software. Now, when I do that, you see that this service was declined. Now, you will always be able to reference back to this in the medical record in case you need to. This is all customizable verbiage here. Here is where they can sign the estimate. Now, this is going to work on any hardware device that you have inside the practice. So again, cell phones, tablets, laptops, and desktops. And so when I go ahead and approve that estimate, if you check in the bottom left-hand corner here, I just captured that signature. And then the best part is now the entire estimate can become my treatment plan with just one click. So when I click Add Products to Plan, and I dive right into my treatment plan just to come full circle for you guys, all of those services, except for the ones that were declined, are now inside my treatment plan. And with just one more click, they can all become my invoice. And so what's truly beautiful about that workflow is that you're building the medical record and the invoice simultaneously without missing a single charge. Charge capture is another huge reason why Dr. Barnes created Shepherd the way that she did. If you did not want to create an estimate before that appointment, it's okay. You don't have to. Those bundles that I showed you will also work right here inside the treatment plan. So hopping into the subjective very briefly, it's pretty self-explanatory. It's where your initial complaint will live, medications, and then the history as it relates to this appointment. Inside the objective, the TPR will live here. Here are the physical exam templates. So again, work smarter, not harder. We're going to come loaded with all of these templates, but just like with everything else, customize these, delete the ones that don't apply. Maybe every doctor wants their own set. That's totally fine too. We're going to make these look exactly how you guys want them to look. But just for the sake of the example, let's just go ahead and choose standard exam template with normals. It really gives you a good representation of what they could look like, right? Everything can be populated in for you. You can make notes, you can add pictures, you can update those categories as you need to. And then my personal favorite, like I mentioned before, are the body maps. So let's just say that we did appreciate a new mass on Moo today, and it's one that we actually recommend being removed. Well, of course, I want to add that to my physical exam findings. So I'm going to go ahead and add a body map. Any body map you guys could ever need will live here. We have every species, the dental charts, the eye charts. Now, if you guys don't see a whole lot of frogs, that's fine. Let's go ahead and inactivate that one. And so you're not even having to see them on your list. But Moo is in fact a canine. So let's go ahead and choose this dog one. And if this is a mass that we recommend being removed, I can even change the color to red, draw on the body map itself, make my notes right here with measurements. These can be moved around to really fit your liking. And then the best part is when you guys click save, you can have your physical exam notes done in a matter of seconds. Your abnormalities will show in red, and that body map lives right down here. Now, if I scroll a little bit down inside the objective part of the SOAP, this is where you're going to see the emotional medical record embedded directly into the SOAP. And what's so great about it being embedded directly into the SOAP is that it makes it possible for you to track the emotional well-being of this patient on a case-by-case basis. And I just love the emotional medical record, and it's all broken down. So by pre-visit management interventions, maybe pheromones we did before the appointment, preferred healthcare provider, preferred entrance to the hospital, the likes and the triggers, and the preferred location for the exam, but also the FAS scoring in different areas of the hospital. So today, if Moo had really high FAS scoring in the reception area and the treatment area, I'm going to know next time to avoid these two areas at all costs. So we'll bring her directly into the exam room. Her FAS scoring inside the exam room is pretty low. So I'm going to know to do all of her toenail trims, all of her anal gland expressions, everything in the exam room with the owner holding, because her FAS scoring is low here and very high inside the treatment area. And this is what will also be tracked right inside the patient record for you to be able to access right at your fingertips every time that you pull up this patient. Hopping into the assessment now. So this is where your problems list lives, diagnoses, chronic conditions, which will always populate for you. And so you're not having to type them out every time, assessment, and prognosis. So let's just say that after speaking with the owner, come to find out Moo has some separation anxiety. She is tearing up the drywall when the client leaves the house. She pants heavily when she leaves the house. This is not me speaking from experience or anything, or maybe it is. I did get my puppy during COVID, so here we are. I can't tell you how many walls I've had in my house, but we're going to go ahead and diagnose Moo with some separation anxiety. And so if I wanted my client to go home with some information on what this diagnosis means, and maybe some tips and tricks on what she can be doing at home to help with this, if I hop right here into my D for discharge instructions, discharge instructions can automatically furnish for you. And this goes on to everything. So anything that you want the clients to go home with. So information on diagnoses like you see here, but medications that were sent home, vaccines, so they know what to expect with a vaccine reaction. But even you can have your doctor-specific surgery discharges automatically furnished. They can all be customized on a case-by-case basis. And then these can be emailed or printed right from here. Or better yet, they can be emailed or printed automatically with the invoice. And so that way, when the client is getting their invoice, they're getting all of the information associated with that visit in one fell swoop. I'm also going to go ahead and delete this little testing one, because obviously if you didn't want to send them home, you can delete those as well. Here in the plan, so all of those services from the estimate that automatically furnished in for me. But God forbid we forget that toenail trim. So I'm going to add that into the treatment plan just to show you guys that you can add things in as you go. And then here's where you can administer the treatments one by one as you give them. But ain't nobody got time to do all that. So just go ahead and administer those treatments all at once, which adds them all onto my invoice for me in one fell swoop. So now Moo is officially ready to go. I'm just going to hop right back into my discharges to show you that everything automatically populated onto my diagnosis, onto the services that she got today, and for the vaccines that she got today. And then you can go to checkout. So as you guys see, from the very beginning of this appointment all the way to the very end of this appointment, it's done in one very streamlined and simple to follow process. And that was really, Shepherd in a nutshell, and how we, showing the fear-free partnership that's built right within the software. And it's really just a taste of what it could look like, but I highly encourage you guys to schedule a demo so we can actually customize the workflow inside your practice together. And I also wanted to hop right back over here because There's also a little testimonial from Dr. Morgan Detweiler, which I love. She's from Towson Animal Clinic, and she is a Shepherd hospital, but also a fear-free certified practice. And she says that Shepherd is fantastic, and we all love it more than we thought we could love any software. I love the integration for fear-free. So I just like to include that because I love testimonials. And then here is my contact information. So please write down my email address, contact me if you guys wanted to schedule a demo. I'm more than happy to answer any questions that you guys have via email, but also now I kind of want to lay the floor out to anybody who has any specific questions for me.
Thank you, Christine. That was great. One thing that I did want to touch on and maybe have you kind of go over is how this integration works within the practices themselves in terms of certified practices versus certified professionals, and how we designate who receives this integration. And if a practice is interested in getting this turned on, how do they go about doing that?
Yeah, so the practice has to be a fear-free certified practice in order for us to turn that integration on, because it can only be turned on from a clinic-wide standpoint. It can't be turned on by a professional standpoint or an individual standpoint, I should say. But if you guys are interested in getting that turned on, you just reach out to us. So what I forgot to also show you is that we have in-software chat support. If you see this little bubble in the right-hand corner down here, this is in-software chat support. Now, these are all real people with real practice experience on the other end. So whatever you need, pick up the phone to give us a call. But if you don't even have the time to do that, just send us a message and we'll get back to you in under 2 minutes. You can send us a message there and just say, hey, I'm interested in turning on my fear-free integration. And then we reach out to Fear-Free to confirm that they're a Fear-Free certified practice. And then we turn that integration on. It's that simple.
That's awesome. So we do have a question. Can mobile clinics or house call businesses use Shepherd?
Yes, Anela, I love Shepherd for our mobile practices. We have a ton of mobile practices. And I mean, you can see how paperless you really can be because everything furnishes in for you. So the answer is yes, absolutely.
Christine, from your experience and from hearing from members, what do you find people love the most about Shepherd? Like what jumps out at them and really helps them in practice on their day-to-day?
To be honest, I feel like my mic drop moment always is the automatic discharge instructions. And that's just me speaking personally too, because when I worked inside the practice, we spent so much time on, veterinary partners, looking up articles to send home, but it just have so many automations through that SOAP workflow happen for you, from the templates and the discharge instructions and everything that can happen. It just saves so much time. And so for the practices that I do talk to, they always tell me, it really has provided us so much more work-life balance because it eliminates so many of the steps that add up on everybody's plates throughout the day. And, eliminates the scanning and attaching and the spending time doing, looking up articles. And there's just so much that it does, and that they're actually able to go home on time at the end of the day.
I mean, who doesn't want to go home on time at the end of the day, right?
Is it too much to ask? I don't think so.
It is. It is. I will say, like, from a fear-free standpoint, I was so excited about the FAS, the graph, being able to show that over time and like in the different areas of the practice, and being able to map it out. Because I think it's so useful to be able to see what, if a patient had a spike somewhere, be able to like go to that spike and figure out what was going on, where were they? I think it's really great to show owners too over time of how their FAS score is coming down. So I think that's such an awesome integration within the PIM system itself.
Me too. And I think it'll truly, it's going to be a game changer for our fear-free certified practices, because it all is embedded right there inside the software that you have access to right at your fingertips.
Yeah, it's great. I know we have a couple people that are in attendance that use Shepherd software. So certainly if anybody that's here wants to add anything, either, raise your hand on the little Zoom screen or, throw it in the question and answer box and we can bring it up that what your experience has been with Shepherd. How many hospitals are you guys with now, Christine?
So gosh, we're pushing 400 now.
That's amazing.
Growing quickly. Yeah, it's all really exciting. Once we release our client communication suite with the unlimited texting, automatic appointment reminders and service reminders and on the client portal, we found that we're able to provide these practices now with so much more than, it's more than just it's the entire client communication suite too, built within the software. So it eliminates our practices from having to pay for third parties completely because everything's built in and all completely complementary.
Yeah. And I love that you have the forms like that can go right into their medical record, like the PVQ, like the EMR is just right there and embedded because I remember being in practice and having to scan it and upload it and attach it, or like try to figure out like, where was it? Did it get saved in what file? And is it on somebody else's desktop? And, and just the fact that it all goes seamlessly into there and keeps it all together is so fantastic. Lisa Worth, I know Lisa is with Arizona, the veterinary ambulance there, and they're a fear-free certified mobile ambulance, which is amazing. She's one of my favorites, and they absolutely love Shepherd. Dakota Thurman, forms are a game changer. Dakota's at OKC, which is awesome. So
amazing.
Thank you guys. Yes. What conferences are you going to be at coming up where some of our members may be able to see you guys in person and meet you? If you guys have not met the Shepherd team in person, I will vouch. They are amazing. They're so fun to hang out with, and their booths are always so fun. If you go by, you have to get, what do you guys call your little news network?
Flock News. Now that
Flock
is
News. Yes.
She kills it. Yeah, you guys. She's a hoot.
She's amazing.
She's amazing. Yeah, we have our own Flock News segment, which is blowing up, which is so exciting. But yeah, so we are actually headed to AVMA here in July, and that's going to be in Colorado. I'm going to be going to the Getaway Asheville, which is that's here. It's going to be in August, at the end of August. We're also going to Fetch, Kansas City. We are going to the Southwest Conference in San Antonio. Not sure about New York Vet yet, but that'll be in October or November if we do that. And then we're also going to Fetch in Long Beach, California in December.
Guys have a busy couple of months coming up.
Listen, it's conference season, and we're ready to go.
Right? It's always
so if you guys are going to be at any of those conferences, come hang out, come say hi to us. We love, obviously we like to talk Shepherd, but we can talk about other things too.
You guys are always so fun to talk with and see what's coming up, seeing what's in the pipeline for Shepherd. And technology advances so quickly that I know that even like the things that you guys show me when I see you, I'm like, the next time I see you, you're going to be updating things and it's going to be different and new. And, Shepherd is definitely, I think, one of the if not the most efficient PIM system that I've come across in my almost 20 years of being out of school. It's so interesting to see how PIM software has changed along the way, but the things that Shepherd has integrated, and I think, like you said, having a ER vet as your founder to say, like, this is what really is needed in practice, and then you guys just took that and ran with it is just amazing.
So the reason I work for Shepherd is because I worked inside the practice too. And so to Dr. Merlo's point, I've worked with my fair share of inefficient softwares. And so when I first saw Shepherd, I was like gobsmacked, like, what? I couldn't even believe something like this existed. I fell in love with it. And so, when I talk about it, I have this passion for it because I just know how much it can really help our hospitals, all of the efficiencies, the ability to streamline the whole practice. It makes me happy to hear you say that, Dr. Merlo. So thank you. I think so too. I've always said it's the best thing since sliced bread. So
No, it really is. And like you said, like just the different things that it can do, the discharges, the forms. For me, it's knowing that like if I need help, there's a real person on the other side of that chat box. It's not a chat bot. Like that's unheard of nowadays, right? Like
Seriously.
so.
And that's a game changer in itself too, because I mean, inside the practice, you guys are busy, so you don't always have time to pick up the phone. Now you will always be able to call us. We have a direct line, but a lot of the times you're not even going to have time to do that. So we have that little chat bubble that you can just send us a message where, yes, to your point, they're not bots. They are all real people with real practice experience on the other end to answer your questions and help you out.
Now, and I know from the fear-free standpoint, I've reviewed hundreds of certified practices and we hear all the time, I don't know how to incorporate what is needed into what we use. And that's always a stumbling block of how do they figure out the forms and getting things in and where do they put the emotional medical record and how do they record the FAS. And so I think this is just another step in the process of making things just more efficient and easier and just getting out of our own way of things. And like there's, we're always saying there's got to be a better way. You guys came up with the better way. So it just makes so much more sense. It's just easier.
Yeah. And anything, anything that we can do to make our practices and everybody inside the practices lives easier, that's what we're here to do. And we're continuing, to your point, Dr. Merlo, what you said earlier, we're continuing to grow our software, and how we grow our software is based off of the feedback of our current users. And so whatever you want to see, if you guys use Shepherd and there are certain things that you want to see inside the software, you tell us about it right inside the software, and it's shot right to my products team. And that inbox gets managed every single month. And it's really to ensure that we're growing our software based off of what you guys want to see and not based off of what we think that you guys want to see. So I love that business model. In my opinion, it's a win-win because we're keeping our practices happy by building in what they want to see, but it's also ensuring that we're growing our software in the right direction, because chances are what the practice wants to see is what other practices want to see. And so it's just kind of, like I said, it's a win-win. So
it is. Well, I know we're coming up on time. This has been so wonderful, Christine. I highly endorse Shepherd. We love them here at Fear Free. They really have been a wonderful partner to work with. We're so excited to see everything that they're doing. And like Christine said, if you're going to be at any of those conferences, stop by their booth, go see Jessica, go get on Flock News, just come hang out. Yeah, she'll pull you in. She's like a polarizing, like you can't get away from her. She's got the great outgoing personality with that microphone. But they're a wonderful team. Some of us from Fear Free will be at AVMA as well. So come talk to us about how we can help you with Fear Free as well as with Shepherd, and just kind of taking your Fear Free to the next level, practice certification, all of that good stuff. We will make sure that this recording of this webinar is available to those who weren't able to attend. And if there's any other questions for Christine or myself, you can always get in touch with us. Christine's email there is on the screen, and mine can be found on the Fear Free website.
Yes. Thank you guys so much for taking the time. Like I was saying before, I can talk about Shepherd all day. So any chance I get, I'm more than happy to do it. So whatever questions you have, if there's something that pops into your head after this call is ended, shoot me an email. I'm very responsive via email. We can either get a call set up, I can answer your questions via email, so on and so forth. So thank you guys so much for the time. Dr. Merlo, thank you too.
Yeah, it was our pleasure. It was great to have you on here, and hopefully you go and enjoy the rest of this beautiful North Carolina, South Carolina day.
I plan to. Thank you. Take care.
All right. Bye, guys.
Bye.